Welcome back, everybody, to another exciting episode of Recharging the Human Battery. I'm your host, Dr. Stefano Sinicropi. I'm joined by my co-host, Mandi, Dickey, today, and we are on AM 950 radio. This is the fourth episode of the Recharging the Human Battery show, and we have been having an intense conversation here before this show started. So we're going to take it in a little bit of a different direction than we were even planning to go, because when we get fired up about something, it's almost an unstoppable train. So good luck trying to stop us today and what we're going to talk about. So what we've been chatting about is the problem with misinformation in the field of medicine. Now, when we say medicine, we're talking medicine everywhere from the most accepted conventional, medicine, drugs, surgeries, what's offered out there, what you guys hear on commercials that we would be considered conventional medicine, all the way down swinging to the other side, which would be things like, homeopathic remedies and off the shelf stuff. I mean, right? You guys know, you go to CVS and, half the store now at CVS are a bunch of these natural products, half of which haven't even been vetted, have no scientific evidence behind them, but yet they've got good marketing, good commercials, and people are buying them because they want to enhance their brain health, or they want to jump higher, or whatever they want to do. And so we want to cut through some of the, the misinformation out there, and how can we do better as providers, and who really needs to be providing that information, and which bodies, what governing bodies, who needs to check it, and do the governing bodies and who's governing the governing bodies, right? Who is making sure that they are putting stamp of approvals on things that are actually real, or is it because of some monetary, issue? And then we're going to talk about how that all plays into skepticism in medicine, and how there are people that are skeptical on all sides, right? Some people are skeptical about drugs that are out there, the most conventionally used drugs, for example, for diabetes, super skeptical about it. People are skeptical about certain vaccines, including ones that, have basically eradicated illness, right? And then the other end, people are super skeptical about all these complementary medicine treatments, some of which have profound data behind them. I wouldn't even put them, in some like things like laser therapy and red light therapy, stuff we've talked about before, profound data behind them. There's other things like energy healing and other things, there's studies all over the place. And there's other things that are clearly untrue, but yet they are still pushed as true remedies. So again, who's responsible for getting this information out? Is this, I mean, am I onto something here? Is this something that we need to be talking about like ad nauseum?
Absolutely. It's something that we deal with every day as practitioners. Patients come in and they have a list of the information that they found online. Hey, I read this. Could this be pertinent to me? And it may or may not. And we as providers have to vet that out. But if we don't have all the knowledge, how are we supposed to vet it?
Absolutely. And so I think we really need to, and this is what we're going to talk about. We're going to talk about this for the hour. I think we really need to talk about skepticism, misinformation, where people can get good information, where can they get good data. And one of the big things that we really need to talk about is safety. So there's two issues with safety. One is the thing that is being recommended in and of itself safe? So in other words, what could be potential harms? Like, like some natural remedies. We don't even know how does it interact with the patient's blood thinner? How does it interact? So half the stuff, we don't even know how it interacts. We don't even know what's in it, right? But on the flip side, safety also comes with, is it safe to use this and ignore a potential more serious problem going down? And we can share, all kinds of anecdotes and things like that, where things have been missed or people have been harmed by things that seem innocuous. So you really need people that are really experts in this stuff, really helping you on your journey along the way. They really need to be very broadly educated on these topics. And we've both made it our priority to be educated on both sides of the coin. So when we come back here on AM 950 radio. We are going to dive into this even further. All right, and welcome back to Recharging the Human Battery radio show. I'm your host, Dr. Stefano Sinicropi, joined by my co-host, nurse practitioner, Mandi, Dickey. We are fired up here on AM 950 radio, and let's get right back into it. Okay, so here's the scenario. Okay, I am a conventionally trained physician, went to Columbia University, trained with some incredible people, right? Giants in medicine. I don't have any other way. I mean, we can drop names and people are in awe of the people that, we trained under, that kind of stuff. Here's the issue though. If a patient comes to my office and has an issue, right? If it's spine related, it's one thing, because a lot of it's very straightforward. They've got a disc herniation, very straightforward. We're either going to, therapy, epidural injection, maybe surgery, laser therapy, whatever. We have a lot of recommendations, very straightforward. But as a physician, as a healer, if somebody comes to me and says, hey, doc, I've got X, I've got this syndrome, or I've got that syndrome, and I want to do this treatment, or I want to do that treatment, the issue is that we have, as we talked about before with Mandi, she used this word. I love this word. So I was really excited. We got fired up. That's why we, we got started a titch late just because we got into this, but we cannot be in our silos, because if we're in silos, we don't know. So let's just give an example. If somebody comes to me and just has low back pain and they don't feel well, right? As just an example, and they say, hey, I'm trying this herb, right, that I figured out on here. I'm going for acupuncture therapy. I'm doing this, I'm doing this, I'm doing that. And I'm skeptical about this. I believe in this. I don't know what to do with that. It is, and again, I'll be the first person to say that I was quite deficient in a lot of the understandings on all of these different remedies, but it is so critical that we, who are really experts on the human body. I mean, both, Mandi and I, we both spent our training learning the ins and outs. I mean, we understand the anatomy of the human body, the physiology, the way things work. We understand when people, potentially are risk, they might have cancer because they've lost weight, or they have, rectal bleeding, whatever. The point is that it is hard to really take care of patients if you don't understand not just the science of medicine and how the body works, how pharmacology works, how traditional drugs that are made in these big corporations, what Baxter is making, Pfizer, all these people. But we also have to understand, well, how does acupuncture work? Like, what's Reiki healing? What do these drugs do? What are the risks of being on boatloads of omega 3s, right? We just need to do a better job in understanding the whole integrative piece, right? Because otherwise we can't do best by the patients. I can't even tell you how many times, it can go both ways. Patients are fixated on a certain drug they're taking, and they think that it's a panacea, but yet they have, six things going on that then you need to treat them with something else. But on the flip side, sometimes other providers that they've seen tell them, oh, you need to get off of this, or don't go to your acupuncturist, or whatever, except it's working. And whether it's working because the acupuncture really works, or whether they're having placebo effects, it doesn't matter. It's working. The patient's better. What's the difference? So, but we have to have a general understanding. What's safe? What's dangerous? When is it dangerous to wait? When is it dangerous to not? What do you think about all this stuff? Am I off base here? I mean, do we need to know all these things? Or should we just say, when patients come in, I'm a spine surgeon, why are you asking me about your diet? Like, why would I? I'm not going to. Why are you asking me? I don't want to talk to you about your depression. Go see your psychiatrist, right?
Yeah.
We need to know more.
We do. We all need to be knowledgeable regardless of what our specialty is. And that's one thing that I think is a little bit different. We were talking before the show about even physicians and nurse practitioners. In nursing school, we learned holistic medicine. We learned about all the different herbs. One of my drug books was actually an herbal drug guide. So we got information on what the different herbal supplements were. However, when a patient comes in our door and they're saying, "Hey, I'm on this supplement," we don't have the time right then and there to look and see what it could be. It might be doing the same thing as one of the prescription medications that they're on. And we don't know that unless we actually look it up. So we have to be knowledgeable about all these other things so that we're not prescribing something that might contraindicate what they're getting elsewhere. It's not to say that those other treatments are not correct, because if it is working, like you said, then we want to keep it going, whether it's placebo or not. When I went in for my first red light therapy, I thought it might be placebo that day, and I was willing to take it because I needed that win, but it wasn't a placebo. That said, if it is, it's still working for the patient, but we do need to be knowledgeable so we don't tell people to stop something that's working for them.
Yeah, well said. Absolutely right. It's just it's difficult. You know this as a conventional provider. I mean, even though in nursing school, and that's fascinating because I actually didn't know that.
Yeah.
I just learned something. I had no idea that you guys had a textbook of
It was cool.
herbology. Honestly, we need that,
Yeah.
as physicians, because my patients are on everything, right? Not only are they on 34 conventional medicines, they're on 14, things that they got at Costco. So I don't we don't even know what I need to have and that's why I'm just really so excited about learning about so many of these different modalities. One of the things though that we fall prey to in conventional medicine, and we can't, and again, we're going on. We need like 7 hours for this this show. This might be part 1 of 7. One of the things we fall into, and I see that with, especially in the MD world, a little less so in the DO world, even though they're kind of wrapped in. They get, again, different training. Osteopathic schools are different. They're more open-minded. It's just different. But one of the things that we get caught in, and listen, I've been caught here too, especially early in my career before my mind kept opening more and more, is we probably think we know a lot more. And so you as providers taking care of people in a medical or just giving any kind of advice, I don't even care, even if it's to your neighbor, you have to base what you're saying on something. Whether it really doesn't matter what it is. You've got to be honest. So one of my pet peeves in traditional medicine is that for some of complementary care or alternative medicine or anything, it just seems that both physicians, nurses, all these people, I'm going to put them in a bucket because they do fall into the conventional medicine space, that you cannot have, in my opinion, unless you're at a cocktail party and you're on your third drink. That's fine. Talk about whatever you want. But in a setting when you're trying to help somebody along, my pet peeve is people that are giving advice without knowing what they're saying, positive or negative. Like recommending something without understanding. Is it safe? Is there science behind it? You don't recommend something just because, like, for example, I don't recommend any drugs to people because the rep told me that it's the greatest thing ever and it's gonna fix the world. But on the other hand, if somebody asked me, for example, I didn't know about like transcranial magnetic therapy. Okay, it's actually FDA approved. It's paid for by insurance, right? Before I started going down this path, I didn't even never heard of it. Right. So if a patient came in and said, I'm doing this, I don't just say, that is ridiculous. That does nothing. I can't believe somebody would try to do that. Okay. And that is and it's funny because I talked to an expert on transcranial magnetic therapy. It is, again, it's approved, it's paid for by insurance, but yet there are people that tell their patients that it's a sham, which is, that's not true. Now, on other things, where there's less known about it. So if somebody comes in and asks me, for example, about, I'm seeing let's just say like a head and neck chiropractic. I mean, there's all these different chiropractic things. I cannot tell them to do it or not do it. All I can say is I don't know anything about it. And if they want me to let me research it, let me get back to you. But I know you see this. Why do we in conventional medicine think that our knowledge in what we're taught somehow extrapolates to things that we have not read a single article about, other than seeing the headline on some time.com, thing on the web. That's not okay. So what do you,
Yeah.
I mean, I know you see this all the time.
I think a lot of it is because of the education that we got. We get almost this narcissistic feeling that we know everything because that's what they taught us in school. And if they didn't teach us in school, then it can't be a thing. But medicine is always evolving. There's always something changing. When I went to school 10 plus years ago, things are different now than they were 10 years ago. So the textbooks that I was reading at the time don't even matter right now in some instances. So medicine has changed, complementary, traditional, if what we want to call it, whatever it may be, it has all changed over time. So we need to be open to learning new things outside of what we learned in school, because that's where we're going to grow and that's where we're going to benefit our patients more.
Absolutely. I mean, and I think you're absolutely right. Again, we're just going to continue to emphasize how important for us to have a more diverse, experience. I mean, right? Like it's a buzzword now, right? Everything's about diversity. Well, we also need diversity in education, in medicine, and that is exposure to all these different fields. And I am a very strong believer that in the medical school environments, whether it be MD school or DL school, and in nursing school environments, and obviously you guys are way ahead of the game as far as as we are. It really needs to be a diverse training in all these things. We should have exposure to acupuncture. We should have exposure to energy healing. We should have exposure to these other things. And the reason being is because people are coming to us to ask us questions about how to manage their mental and their physical health. And if we don't know about things, the best we can do if we don't know about it, which I would recommend to everybody, is just say, I really don't know. And you should consult a thing. And if you have, a friend that's a functional medicine doctor, integrative health, maybe go that way. If you're more, wanting to lean them towards kind of an MD or a DL, whatever, you can't just make these assumptions because we don't know. Like one of the things, and I've mentioned this many times when I had Dr. Nussbaum, my partner, an absolute like beyond renown neurosurgeon who does stuff that the vast majority of neurosurgeons wouldn't even think about doing, right? Because it requires out of the box thinking, a tremendous amount of training, whatever. Just a world renowned guy. I asked him, how much do we know about concussion? What do we know about the brain? What do we know about how these complementary modalities might heal the brain and stuff? His answer is almost nothing.
Yeah.
Almost not. And this is the mindset that we need to have. There's things that we know, at least, but they're evolving. Like you said, we know them, but they're evolving. Okay. But data is coming more and more. It's going to come faster and faster with AI. So we know certain things work. Other things are more in those gray zones, but there are patients that swear by them. There's patients that don't. We need to have an understanding before we start counseling people on, yeah, you should continue that, or yeah, you shouldn't, right? Based on if they say there's some stuff like if somebody comes, like no one should tell somebody not to do Reiki healing unless they're like avoiding their oncologist, right? Because they have cancer. That's different. That you can say, no, you have to go to your oncologist, but please, if the healing is making your energy level better, great.
Yeah.
Right. Even if you don't know anything about it. Why? Because it's safe.
Yeah.
It's laying on there's nothing happening. Now, on the other hand, right, there's other things. And again, I'm a huge proponent of chiropractic care, and there's some really, really good chiropractors here in the state of Minnesota. Now, now again, there's big variance in the way in the ways chiropractors practice, but there's something called the Minnesota Chiropractic Association. They're excellent. I've worked with their management team. I've presented at one of their meetings, and they want to do the right thing. And there's chiropractic neurologists and chiropractic radiologists, all these people, and they're doing their best to think. On the other hand, with certain conditions, right? If somebody has a significant spinal stenosis in their neck, I do steer them away from potential manipulation because that can potentially cause an injury if you have cord compression. And there are obviously reports of vertebral artery injury in certain patients and things like that. So we have to be really careful, but that doesn't mean I told people not to go to their chiropractor when they say, yeah, they're working on my shoulder and it's amazing. And I say, what? what, I'm going to send you to my, orthopedic surgery buddy because he knows more and he'll take care of you. Meanwhile, it's just like a rotator cuff, strain. Let's go. We got to be really, really careful. So so that then segues into really what we've just talked about, right? So we just talked about the conventional medical people tell them sometimes, oh, that's terrible, that's sham, whatever, without even knowing.
Mm-hmm.
And listen, folks, there's a lot of things that are sham out there, a lot. And that's why we're trying to cut through the noise. There's a lot. If you look at what's on the shelf, right, some of these natural remedies and stuff like that, more of them than not, by probably a large majority, do nothing. And some of them can have size. So we need to understand. So before I recommend anything, I know about it. And before Mandi says anything, we know about it. Why? Because we have licensing boards and we are actually, checked. On the other hand, complementary, docs that really believe in their stuff, it is up to them to make sure that what they're doing doesn't pose a danger. And if there is some danger, they need to, be very clear. But what they are doing also on the flip side, right? Because I've listened to some of their conventions and things like that, is they also want to attack, right, the traditional medicine world. And that sometimes really hurts patients because then they're not seeking treatment that is actually would be great for them, right? And that kind of stuff. So what does this all breed? It breeds distrust, misinformation, and skepticism, right? So we both know, and we can give all kinds of anecdotes. I have patients that are so skeptical about anything do with traditional medicine, like anything, right? If you say the word like discectomy, like they almost pass out. Meanwhile, they have a massive herniation and their foot doesn't move. And they can't even wrap their minds around the S word for surgery. Yet we know that the results of that are phenomenal. It's one of the best studied things, right, that we do. And then I have other patients, right, that they are so skeptical. I tell them, you know what, this thing, like, for example, we constantly talk about laser and photobiomodulation. There's 6,000 studies, 6,000 articles and growing exponentially. There's all these clinics run by doctors that do it. And they're like, no, that would never work. It's impossible. I don't believe that. Or, there's a study in this therapy for migraine. They're like, that's impossible. That there's no way. And so this is what happens when we're living, like when we live in our silos. So would you agree that it's this attitude, it's this mindset where we don't see each other. We see each other as us versus them versus we're really all in it together.
Yeah.
And let's figure out a way to dish out real information with real studies, real data. And some of that data, again, can be anecdotal because there's some things like when we get into energy healing, like, I have this upcoming podcast where we're going to talk about scalar energy and Tesla and energy healing and stuff like that. How are we going to do a randomized control? I mean, it's some things you just, again, we talked about it before. Some things, religion, we're going on faith. There are other things. If you're just seeing patient after patient be improved by X, it's probably helping in some way, whether it be placebo, whether it be whatever, is spontaneous remission. I don't know. We don't know, but we need to learn. So we need to talk to each other to figure out a way to get around this.
Absolutely. Yeah. So as you said, the skepticism on both sides of the bridge are problems because complementary medicine is begging on or kicking on the traditional medicine and Western medicine, whatever. It goes both ways. Whereas when I was working in the hospital, we work as a team. So cardiology, internal medicine, neurology, neurosurgery, we all talk to each other and come up with a plan for the patient. But we don't do that outside of our typical medical EMRs, electronic medical records. If we don't have access to it there, then we don't think of it as something that's part of our care. So chiropractic care, red light therapy, any of these other complementary therapies don't have electronic medical records like we do in traditional medicine. So if we don't see it, we don't communicate and we're not playing part of the team. We can't be at each other's throat because that's not beneficial for the patient. There's a time when surgery is indicated. There's a time when red light therapy is indicated and all of the above. And we have to be able to merge those together and play well in the sand together. We're all on the same team. It's not us versus them, home versus away team. My son plays baseball, so it's a good analogy there.
Yes, absolutely.
We can't be fighting against each other because the person in the middle is the patient.
Absolutely. And I say that, when I get on my rants, and lately there's been a lot of them. When I get on my rants and I hear something that's told to a patient where they're steered one way or another, or they are mistreated in their own way, or their patient at least, you know what, mistreatment, if a patient perceived they're mistreated, they're mistreated. Whether or not, it doesn't matter what your perception is, we need to make sure that, but anytime I hear this stuff, I say that all the time. I'm like, there is a human being in front of you. And we that have taken up the torch of being healers, really ultimately, yes, it is like coming to the realization that as a surgeon, I'm not just a technician, right? And obviously I'm a doctor, so I have to understand how the body works if they're at risk of anesthesia. I'm not talking about the hardcore Western medical, how the body works, physiology, but we really need to think about there's a human in front of us, and we really need to heal them as a whole, because this is what we signed up for. That is literally what doctor means, physician means. It's like, this is what we're supposed to be doing. And so words are so powerful. It's the way we say things to people and the way we, whatever. And not only that, just now I'm good. I'm a digression machine, actually. You talk about placebo effect. Do you want to, I'll give you a very quick way to make people worse, okay, for pain. And you know what? For people that want to call in or do whatever, prove me wrong. If I'm a doctor and you come in and you are getting good benefit out of acupuncture, you're getting good benefit out of whatever therapy you're doing, right? Whatever vibrational healing, there's all the sound, music therapy, whatever. And I tell you that is a complete sham, and start yelling at you, why would you do that? And again, without having any knowledge, right? Because most times the people don't even know what they're talking about, right? And I just say, you know what? That is ridiculous. I can't believe you're doing that. You know what you've just done? You have just taken hope away from that patient. And you know this.
Yep.
When you have pain, when you are suffering, whatever else is going on, hope.
Yeah.
You talk about one of the most important things about positive energy, whatever, it is hope, right? 100%. When people lose hope, it's over. It is over. And so we have to be really cognizant too, now that we get to, now that we're getting to discussion about not taking away people's hope. Now, very different than they come in and say, I'm doing this treatment, and you know that it's dangerous. Right. And then you say, time out. I'm sorry, I have to have a very difficult conversation with you. We're going to find other things for you. But here is what 3 of the studies I read on this, and here are what the outcomes were. So would you agree, like the hope factor?
Yeah.
Like people, again, going back to the placebo effect. And again, I want people to know that, both of our, mentalities, especially since, we are so into health, wealth, and health and well-being, is that these things should have scientific backing. We should be able to eventually, over time, prove that they're efficacious, like in a good way. So I want everyone to know that a lot of the things we talk about and we promote, we scientifically vetted. Okay, that's just the way we are. Okay, so I don't want people to to think that that we're just saying that. However, in certain situations where it's a little gray and there's some danger, we do have to sort of steer people away from that. But again, if we don't know about it, we can't do it. So we have to be whole practitioners, no matter what. If you're a gastroenterologist, it's important. If you're a woman's health doctor, it's beyond important to understand all of this soft stuff, these things that people call pseudoscience. It's not pseudoscience. We call it life.
Yeah.
Right? Because everything's pseudoscience. Like how I feel today, that's pseudoscience, like, right? It's just, I'm just telling. So let's just go back to the hope thing. Like, how important do you see it? Like, especially as a brain, specialist, right? Those
Yeah.
patients that have had that, like, and you've been through your own trials and tribulations. I mean, when somebody has a brain injury or somebody is recovering from a tumor resection, if they don't have hope,
Yeah.
their recovery's, it's no good.
It's not. And I was just going to say from my own healing recovery too, it's when I didn't have hope, it was so hard to see that next day happening even. So you have to have the hope in order to keep going. And I've seen it in my patients time and time again. If they didn't see things happening for them, they were spiraling down really quickly. Post-stroke patients, if they couldn't see their improvements, they'd come in time after time for appointments, and I would identify little teeny things that they could do today that they couldn't do last time, and all of a sudden you could see that spark of hope come back again. And that's what they needed to keep pushing forward. If they don't have the hope, it's hard to push forward in really tough situations.
No, absolutely. And we find that, like, in the, in the spine surgery world, I see, I mean, absolute, because, Midwest Spine and Brain, we see so many disasters. I don't know how else to put it, where people have had, 7 operations somewhere else, and they come, not that there's anything wrong with those surgeries, just one thing after another, or they've had some horrible spine whatever's happened, and then we're kind of visiting for the first time. It is so important for us to provide them hope, and that's why it is so, I just feel so empowered having such a larger toolbox than I did even 3 years ago.
Mhm.
Understanding so much about how complementary, therapy. So I'm just going to give an example as a spine surgeon. It's a little bit different, but as a spine surgeon, if you come in and you've had 9 surgeries before, let's say in Iowa, right? You're up here, you're a mess. You're on narcotics, boatloads, all this other stuff, right? What is the thing? So I'm going to start from the top down, right? We're going to say, number one, can we identify a surgical lesion that potentially can give you any improved relief? Was anything missed? Did something develop in the meantime? Whatever. Is the rod broken? Whatever. Then the next thing is, are there other higher level treatments like spinal cord stimulators, potentially even doing pain, whatever. These are high level things that we reserve. In my practice, I reserve them for the worst of the worst, because there's so many other options for other patients. We never go there, but that is an option for these patients. Right. The next step down, injections, right? Is there an epidural? Is there a SI joint injection? Whatever it may be. Are there trigger point injections? We can do whatever. And then coming down from there, right? Are there physical therapy treatments, chiropractic treatments? Do they need to be in occupational therapy? Do they need to be doing those things? And then we start getting into, are there medications that need to be titrated and adjusted? And again, are there things outside the opioid world? Because everything that we do now is really trying to fight the opioid crisis and be outside the opioid. Well, we still need to use them in some patients, but we need to use them a lot less than is thought. Like a lot less. We'll get there. That's a whole other episode that we'll do. And then as you come down the pipe, then you start getting into the photo. And now again, we're still in that world of things that have hardcore scientific proof: photobiomodulation, laser therapies, oxygen therapies. I mean, listen, hyperbaric oxygen and exercise, these things have been I sat next to this brilliant researcher last week when I was down at the Capitol lobbying for photobiomodulation, of all things, and he was showing me his hyperbaric chamber research that he was doing in 1980. It's 2024, and this is like, oxygen therapy is controversial. Come on. Right now, there's some risks of hyperbaric oxygen, and that's why we like exercise while under oxygen. But it doesn't matter. Oxygen therapy works on so many things. We could list. That's a whole other thing. And then now we're going to go down to the more, sub acupuncture, energy healing, Reiki, what chakras, whatever, right? And then on overlaying all that, we're going to have other things like meditation, breath work, all things that even, a couple decades ago, yeah, people were doing it, but where were they doing it? In Southern California, right? Everybody else thought this was all like fluff, right? But now, how many scientific articles are out there on meditation and the healing that can happen from it, and the way the body releases endorphins and epigenetics, how your genes change. Sorry, again, on a rant, but there are so many things that we can offer patients. And the reason I say all that is because I want to set the stage for this. How many times, it is a pet peeve of mine, it actually makes me, how many times in the spine world, okay, that you've treated a lot of spine, How many times did people hear this? There's nothing. It's too far gone. There's nothing to do. You're just going to have to learn to live with your pain. What do you want me to do? How many times? I
Mhm.
mean,
Oh, too often, way too often. I can't even put a number to it. And all the patients that I've treated, I've heard that so many times.
and to me, we're healers.
Yeah.
That is not an acceptable response. I don't care. I'm not saying I'm not the docs that are saying this, some of them, and not docs, nurses,
Yeah.
whoever, some of them are literally in their field the best of the best technical, right? If I had an issue, I might say, hey, I need 4 screws. I might diagnose myself, which is a really bad idea, but let's say I had like a 1 level spot. I'd say, yeah, I need 4 screws here. I need you to do a TLIF and this doc, and they'll make like and I know they're going to do a beautiful job, right, with it, and that's great. So I'm not trying to take away from the fact that they are brilliant people that just could be renowned, could know everything. However, you have to understand, you can hurt people by just saying to them, well, you're screwed.
Mhm.
I can't even find a way to do. I literally, like, sometimes I'll have like an uncomfortable pause with a patient. I'll just be staring at them because I'm going through my mental Rolodex of everything I've ever learned and known.
Yeah.
Right. And if it's one of those things where they come in with some crazy thing that I'm really thrown off, or it's so far outside of my field, I say, you know what? I don't know. But the next time you come, they give it. And some of they're excited. Next time they come with articles about like these rare diseases that honestly, I don't even remember from med school because like, I don't see that. It's not my specialty.
Yeah.
But and that just a doctor saying, I'm interested in you. I'm interested in your rare blood disease, even though I'm a spine surgeon and I really have no idea what you're talking about. That is hope. Somebody cares about me. Somebody hopes. So again, I'm sure you've seen that.
Yeah. Yeah. Well, I've even done it myself. So I've learned about things and I've sent it off to my neurologist and said, hey, this is something new I just learned about. Could you look into this? Would this be something that would be appropriate for me? And I like when my patients do that too. And I'm kind of weird in that respect anyway, because I do like when my patients give information. But one thing to kind of tag on that, you were talking about all these different levels. Again, back to nursing school, and we learned about this holistic medicine thing. One of the first things we learned about was how lifestyle management can make a bigger impact than pharmaceuticals. So that was always the first thing that I looked at. What can you do, diet, exercise related, outside of the surgery world?
Right.
What can you do to try to fix this? Because you have a big part in this as well. What other things can we do? What other things can we consider? Looking at all of the different options. And when you come to me with a suggestion, hey, I learned about this. If it's something I don't know about, I'm gonna look it up and say, "Hey, give me a minute. Let me look that up, and I'll get back to you and decide if whether or not this might be something for you." Because it might not be something that's found in the New England Journal of Medicine, for
Right.
example, and that's part of the problem that we're facing with all of this actually, is that when we think about traditional medicine, we look at that journal. That's like the number one journal, and if it's not in that journal, then it's not real. But there are so many other medical journals out there that talk about all of these other treatments, and there is research to back it all up. We just don't know because it's not been presented to
Yes.
us, and if we're not curious enough to look for it, we're not gonna find it.
I mean, that's absolutely correct. We're not familiar. I mean, there's a familiarity, and there's so much out there. It's a big world,
Mhm.
right? It's like growing up your whole life, in here in the Twin Cities, and then you're just basically all your recommendations on restaurants, theater, whatever is all based on your small experience
What
here.
you know. Yeah.
Folks, it's a big world. And in the world of medicine, and I'm going to make that very broad because it's just I mean, in the world of medicine, it's very broad. Like, what is medicine anyway? Like, what is why are we so interested in medicine? We're interested in medicine because it helps people to lead better lives. It helps them to heal. There's all levels of stuff from trauma all the way down to depression. I mean, it's so broad, it's so big, and so we need to step outside of what we know and learn. And I love what you do when we don't know, either research about it or send them to somebody that we know that maybe can have but maybe sometimes I don't know.
Yeah.
Right. So I use, like a physical medicine rehabilitation specialist, or I use a psychiatrist that I work with or whoever and say, you know what, you're asking me a really difficult, detailed thing about your psychiatric condition, and then you're asking me about complementary care. Well, first of all, I'd have to learn everything about your particular brand of bipolar disorder before I could even know, how then this treatment would affect us. So when I mean, some things are just too far outside.
Yeah.
If they just said, should I do red light therapy for my psych? All you have to do is Google it. Red light therapy has studies on all kinds of psychiatric and neurologic conditions that are positive and show all this stuff. But if it's some nuanced thing, of course I'm going to refer them to somebody else
Yeah.
to make that decision, because I don't know. And so, as my partner Hart says, as we close this session, we need to know what we don't know. Little life advice. So on the other side of this break, unfortunately, we're going to have to wrap this one up, but we will come back with a part 2 on this, because there's just too much to unpack on our short hour together. So we'll see you on the other side. All right, welcome back here to the last little snippet of Recharging the Human Battery. I'm Dr. Stefano Sinicropi, your host, joined by co-host Mandi, Dickey, our brain specialist nurse practitioner. We are on AM 950 radio. We're fired up. We're going to have a part 2 on this, because we just haven't gotten through, half of the stuff that we even want to talk about. And half the time we don't even know what we want to talk about, but we know we want to talk about a lot of stuff for you guys. So let's just wrap this up this way. We talked about like the complementary crowd, and then we talked about the traditional crowd, of which I ran with that crew for a long time. Now I'm somewhere in between. And we talked about giving patients the proper information on whether or not you're on one side or the other. You really need to understand. Now, complementary care is there's a lot of stuff in complementary care. There's not like one thing. There's a huge list. We can go through that on the next episode, like what's considered complementary, what's in between. And so for traditional providers, at least learning something about that, I think like on the complementary side, they have to be really careful again about providing misinformation, where they're saying, oh, if you just do this treatment 6 more times, give me another 10 sessions. While clearly there is evidence of patients deteriorating, and then they end up having some horrific thing going on. All of this soup, right? This primordial soup, right? It all mixes into a lot of confusion. People don't know who to trust and what to do. So I think that we all need to get better educated so that we can give the right advice to patients, or at least keep them in that safety zone. When we look at the bell curve, we got to be inside, like we have to be within one standard deviation on each side on kind of what we're recommending and what we're doing. Because if we're outside of those curves, that's where people can get hurt, either by not seeking treatment or by getting way overkill stuff, even in conventional medicine, when people are on 30 different medications. And so misinformation, mistrust is something you're going to hear a lot on this show, because we got to cut through the noise. And we're hoping as experts that we can cut through some of the noise for you, so that you guys can call in with your questions, or go on the podcast online and just put your question and just say, hey, what about this? And we'll learn about it, and we'll come back and say, yeah, it's good or not. Again, this is not medical advice. You have to come see us if you want actual medical advice. None of this is a substitute for your own doctors and who you choose to see. But it is really important for us to be out here, and other experts to be out here doing this, and really making sure that we help you to at least be safe, but then seek and find the right care.
Yeah, there's so much out there, so much to try to dig through. It's hard to do on your own if you don't know where to look. And I actually made a post about this on social media recently, that there's so much information, but you have to be cautious on where you look, because not everything online is a reputable source. That said, not every time you ask a professional are you going to get 100% of the answer either, just because of what we've just been talking about. We don't always know the answers, but hopefully we can help with some of that.
Well, hopefully on today's show, we've helped you some. hopefully we've at least helped you to stimulate these conversations. And I urge you to have some of these conversations with your own providers, whether they be complementary, care providers or ask them, what do you think about this? What do you think about that? Always be learning. Do your own research. It's so important. We've talked about that ad nauseum on this show, Recharging the Human Battery. Obviously, we're going to help you to get better as best as we can, but we're going to also help you cut through the noise. What's real, what's not real. And we're going to do that by learning about it as much as we can, bringing on experts to talk about it, and then giving you our best, I don't want to say guesstimate, but our best scientifically based, intuitive understanding of what we know on that topic. Until next time on Recharging the Human Battery, this has been an absolute blast to be on AM 950 radio. We'll see you guys on the next show.